فرصة عظيمة ان احنا معانا عايشة الحجار النهاردة في مامز هيفن، وانا I just want to ask you, like, we'll tell you something and you tell me your opinion.
Inshallah, inshallah.
Upright position in birth.
Upright position in birth is the only position in birth. That's my opinion.
Okay.
You want to get a baby out? Please don't try to lay on your back and get a baby out. Get up and let gravity help. Absolutely.
Okay. Epidural and pain management medication in labor and birth. Can we do it birth without these?
Of course we can do birth without it. Most women can. There's a time and a place for everything, including pain medication. But for a woman to tell me that she wants to have pain medication before she's ever tried the coping techniques of natural birth, that's pain medication for fear. That's not pain medication for pain. Because if you haven't tried doing the birth naturally with the coping techniques, then you're just taking the pain medication because you're afraid you can't do it. So at the end of the day, I think that if women learn how to work with their body and how to cope with the pain, most women can do it without the pain medication. And it leads to less complications for mom and baby. So I always tell moms, have plan A to do the birth completely natural with the natural coping techniques. And then if you really can't handle it, you got the drugs. And the B can be your drugs. But if your plan A is the drugs, you got nothing else. And the drugs don't work for you, or you can't get them when you want them, or whatever, you've got nothing else. Always learn the natural coping techniques, and you might surprise yourself. There's a secret in birth, and that's that you're stronger than you think. Women are strong. They just don't know it. Subhanallah.
Okay. Tear and episiotomy. Could I do it without episiotomy?
Most births, yes, you can have a birth without episiotomy. And in fact, the World Health Organization says 10% of women around the world will need an episiotomy. So that means 90% of women don't need an episiotomy. Is there a time and a place for it? Of course, just like every medical intervention, there's a time and a place for everything. But 90% of women don't need an episiotomy. And if you compare episiotomy to tears, the natural tear, first of all, if we don't cut you 50-50, a first-time mom, for example, she's going to tear. So 50% of women will have no tear, 50% will tear. We know that. Of the 50% that will tear, most of those will just be skin tears. We call that a first-degree tear. It's not a big deal. It heals really quickly. Most of the time, it doesn't even need suturing. It might, but a lot of times it doesn't. Second-degree tear is into the muscle layer. You know, you can tear into the muscle layer, but you know what? If you have an episiotomy, 100% of those are going to be muscle tears because we cannot cut you without cutting the muscle. So if we cut you, automatically you're getting a second-degree injury. If we don't cut you, 50% you have no damage, 50% is only, the other 50%, most of those are just going to be skin tears. And then it might be a muscle tear, but those are no worse than your episiotomy. So at the end of the day...
we at the end of the day, we want to be of the 50% that do not need episiotomy and do not have tear too.
Don't have tear. And if they do, it's usually less damaging than the episiotomy anyway.
So, let me know your crucial advice for mom, what they can do to not having this tear. What is the most important thing that they can do during pregnancy and labor to avoid having tear?
Well, first of all, you do your pregnancy exercises. So that includes your squats, that includes your Kegel exercises where you're squeezing and releasing this muscle, your butterflies. All of these things are helping to prepare that part of your body for birth. And then, of course, nutrition. You need to be hydrated well. You need to have fats and oils in your diets. You have to have soft, supple skin as much as possible. Some women will try doing perineal massage. The research doesn't say whether or not that really helps. It can't hurt, but it's not necessary. At the end of the day, I think the most important thing is to birth the head of the baby very slow. Very, very slow. So when that baby's head is being born, when you're pushing, I don't want everybody screaming at the mom, push, push, push.
So we don't want to push at all, right?
You want to slow down. Let the mother push if she feels like it, but to her own point of comfort. Mom will know, like as soon as that baby's head breaks through that vaginal opening, she'll stop pushing. And the head will be born and it'll stop. That'll give the shoulders a chance to rotate before the shoulders are born. If everybody's screaming at her, push, 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 she pushes and she pushes past the shoulders, and then what do we get? We get a tear. But I'm also going to say, don't be disappointed if you have a tear. 50% of moms are going to have a tear. It's not the end of the world. It is less damaging typically than the episiotomy scissors. Sometimes you'll have a baby, he has his hand up on his head while he's being delivered, and then his elbow will come and it'll tear you as he's being born. There's nothing anybody did wrong. You didn't do anything wrong. The doctor didn't do anything wrong. Just your little person decided to have his hand up here while he's being born. So we could do everything. You could eat right, you could exercise, you could birth slowly, you can have a doctor protecting your perineum, and you could still tear. That can happen. But you know what? It's still less damaging typically than the scissors are. So, I always tell moms, like, birth slowly, take care of yourself during pregnancy, eat well, exercise, birth slowly as much as you can, push that head out as slow as you can. And at the end of the day, Alhamdulillah, 50% will have no injury at all, and even if you do tear, it's not as bad as you think. Alhamdulillah, the natural tears heal quite quickly, and they're usually far less painful than the scissors are. SubhanAllah.
Okay, another question, Aisha. What do you think about delayed cord clamping and skin-to-skin contact? Is it a must?
Oh, absolutely. You want delayed cord clamping for a couple of reasons. Number one, when you delay the cord clamping, you're allowing all the blood to transfuse to the baby. That is stem cell rich blood that circulates through the baby's body quickly and helps them to heal. Stem cells can turn into any other cell. That's what's so magical about them. They can travel through the baby's body and they can heal any part of the baby's body that might have been bumped and banged during the birth. So you want those stem cells. The other thing is when we cut the baby's cord immediately, you're robbing the baby of 1/3 of his blood. You're making the baby anemic when you immediately cut the cord. So why do you want to make a sick baby? Just slow down. Let the blood transfer to the baby. The World Health Organization says we should allow the transfer of the placental blood to the baby a minimum of 3 minutes, 3 times around the clock for the vaginal birth, and a minimum of 1 time around the clock for cesarean mom. Now, having said that, as a midwife, I don't like to clamp the cord and cut it until after the placenta is born. Just wait till the placenta comes. There's no rush. Let the baby have all of his blood volume.
So all the matter is time.
It's just time.
Wait,
it's just time.
Just wait. Yeah.
Absolutely. And the other thing is when you let all the blood go to the baby, you're going to have a lighter placenta. You have less likelihood of postpartum hemorrhage for your mom. Okay. So, and which is the other part of skin to skin, by the way. Not only is it, the baby's only instinct is to be right here and to find the breast, but having the baby skin to skin with mom will help the mom have high oxytocin, which is the hormone of love and bonding. But it's also the hormone that's going to help her uterus to shrink down after birth. Yes. Shrinking down of the uterus after birth is so important so that it sheds the the placenta off the uterine wall, and it shrinks the uterus down to a small size. Used to be big like a watermelon with a baby in it. Now it's very small. Yeah. This means that the open blood vessels where the placenta used to be are squeezed down, and the mother's less likely to bleed to death. Having that baby right here skin to skin facilitates that natural process. SubhanAllah.
Okay. Maybe last an important question too. Many moms says, if I do everything, I do exercise and eat well and do everything, and in labor she's doing amazing. Mm-hmm. Many mom we face with failure to progress. Mm-hmm. We do everything and mom do everything, and we try to help with positions and everything, and then it comes to mom, you need a C-section. Mm-hmm. So many mom faced, after I do all this, can it end by C-section?
Of course, any birth can end by C-section. And here's the thing. You're Muslim. I want you to tie your camel. I want you to do your best. I want you to prepare. I want you to plan. And then you trust Allah for the end. And a healthy baby by C-section is way better than a natural birth with a baby a natural birth and you have a baby that's compromised. So at the end of the day, it's like when you get to the point where you're needing to submit to a C-section, which can happen in some cases. It's rare. It's not the normal. But if you get to a situation where you need to submit to a C-section, you've done everything. You can rest assured in your heart that you did everything. And a C-section can be a very empowering birth. Alhamdulillah for the medical teams that we have that can do C-section when we need them. The World Health Organization says 10 to 15% of moms need a C-section. And that's okay if you become one of those 10 to 15%. Alhamdulillah that we have that skill and we're able to save babies.
So how can I know? The question is, how can I know? I don't want to have the 2 labor and 2 pain, Mm-hmm. How can I know? I don't want to face these 2. This is the question.
You don't know. You don't know. But here's the thing. A C-section is no joke, guys. It's major abdominal surgery. When you need it, alhamdulillah, we can do it. Don't sign up for it, though. Don't sign up for major abdominal surgery. This is way harder on your body. Not to mention that if you go through labor itself has a purpose for both mom and baby. And if you allow yourself to go through labor and you end by C-section, at least we know baby's full term, we know the baby's ready to come. You have the benefits of the hormones and everything that happens in labor. So it's not like your labor was wasted just because you had a C-section.
Another important thing is this transition to mom and transition to baby. Yes. Having this labor pain is good for mom and for baby. Yes. It is a life-changing for mom.
Absolutely.
So your body
it's a bridge. It's a bridge from pregnancy to motherhood. Yeah. So, inshallah, you don't end by C-section, but if you do, I want you to realize that you are sacrificing yourself for your baby, and that's what motherhood is. If that is your outcome, I just want you to accept what Allah's qadr is for you, and I want you to love your baby, and don't beat yourself up over whatever mode of birth if it wasn't what you planned. We don't always get what we plan, but we get what Allah plans for us. Subhanallah.
Yes. Okay. So the question is, why it happened to me? Why there is failure to progress? What's wrong with me?
Well, I don't know that anything's wrong with you. Sometimes it can be positional. Sometimes it can be the baby. Sometimes the baby's umbilical cord is short. You know, sometimes the baby is tangled up in the cord and he can't come down. There are many different reasons why there could be failure to progress. It could be hormonal. You know, at the end of the day, I don't know why any particular woman is potentially failing to progress. A lot of times it's failure to be patient, I'll be honest with you. Sometimes the doctors are not patient enough. But if, you know, we've given you all the time, and like you said, we've done all the positional things, and we get to the point where, you know, this is not happening, like, subhanAllah, I always say, you know, just relax and submit. And if at the end of the day that is what Allah wrote for you, we don't necessarily know why, and it doesn't mean that it's going to happen in the next birth either. I always say give yourself a chance. Always do a trial of labor after cesarean section. If you have a cesarean section, again, if you allow yourself to go into labor, we know that your baby is ready, and that gives you the opportunity to transition, like you said, to motherhood. And then at the end of the day, 86% of women will have a successful VBAC, and some women will end up having a repeat cesarean. But alhamdulillah, you know that you did your best either way.
Yeah. What do you think about repeated C-section? What is the most advice that you want mom to maximize their success rate in having successful vaginal birth after cesarean?
Number one, exercise and eat well. Take care of yourself into pregnancy. The number two thing that I would say is commit to doing your birth without any drugs. No induction drugs, because that's hard on a scar.
Already not allowed. Not allowed to use any medication or drugs during.
I can't say that it's not allowed by who. I'm saying if I want to support a mom with a VBAC, I don't want her to have any induction drugs, because that can be too taxing on the scar. And then I also want to make sure that the mother is not on any pain drugs. I want her to be able to feel her contractions, because one of the signs of a uterine rupture, which is what everybody's afraid of, but to be honest with you, it's less than 1%, 99% you're not going to rupture. But if you do rupture, then you're going to feel pain in between contractions. If you're on pain meds, how am I going to know that? Not to mention, you're not going to be in an upright position if you're on medication. I want you to be upright and mobile and help that baby move through the pelvis. So my number one thing for moms is don't be on pain drugs, which means you need to learn natural coping techniques so that you can cope with the labor. Yeah.
Is childbirth education classes is a must? This is the question. I have to take childbirth education classes?
Nobody has to take childbirth education classes. Is it a must? No, but let me tell you something. The stuff that you learn in childbirth education is life-changing, and it's not just about childbirth. Yeah. It's about life. And at the end of the day, if it helps you to cope with labor and it prevents you from having interventions, people always talk about it's expensive. Well, you know what? It's a lot less expensive than the interventions that you will get in childbirth if you don't have childbirth education. And I think about what do you save? Think about the trauma that you save for mom, the trauma that you save for baby. That's priceless at the end of the day. You know, and yes, childbirth is instinctual, and you know, most women can give birth instinctually if we leave them alone to do that. But you're not going to go out under a palm tree like Mariam and give birth by yourself. You're going to go into a hospital where there's lots of interventions offered, there's lots of interruptions. So you need to learn how to cope with all of that so that you can still have a natural birth, inshallah.
But thank you, Aisha, for this important info. I hope every mom get benefit from it, and thank you for being in Egypt. Thank you for training doulas in Egypt. Yeah, Aisha Alhajjar, maybe everyone has to know that Aisha Alhajjar is the first one who do doula training like 13 years ago. And the first doula trained and certified in Egypt. And they are a lot. I don't remember the number, but they are from different countries. They're coming for the doula training, and they are trained. And now Aisha is responsible for Amani organization. It's assisting mother of active instinctive birth. So Aisha, can you say something about your organization for anyone who want to train as a doula or childbirth educator?
Yeah, absolutely. So Amani Birth, you know, of course, it's at amanibirth.com, and like you said, it's assisting mothers for active, natural, instinctive birth. And Amani Birth is really there to support moms and their community that surrounds them, the husband, the mother-in-law, the mother of the mother. Like, we're there to support everybody to make informed decisions. We would like everybody to have a natural birth, but that's not realistic for everyone. What we really want is for moms and dads to have the knowledge to make informed decisions about when to submit to and accept medical intervention when it's necessary, and when to refuse and say no thank you, and to stay the course of natural birth. We want them to be prepared mentally, physically, emotionally for the birth. What are you supposed to eat? How are you supposed to exercise? Like, all of these things. Nobody's telling you this in the street. You don't learn this in high school. You don't learn it in college. You know, most doctors are not spending time. You don't learn it. No, you don't learn it in media. You might get tidbits of information, but it's a very like intuitive course from start to finish that really gets you ready. So
yeah, what I can say about childbirth education, it's a really mind shift for families.
Yes.
It's not only for the mom.
yes,
Attending childbirth education, like the way Aisha in her organization did like 10 program. Why 10? Many moms say, why I have to attend 10 classes? Because we need to want to change your mind.
Yes.
We want you to think in another way.
and we want
When
you to be able to,
face
we
the
teach you
community.
something,
Yes,
right?
yes.
And we want to teach you and then have you practice, teach you and have you practice. So, you know, it's a journey. Childbirth is a journey. Allah doesn't, you're not pregnant today and give birth tomorrow. Allah gives you time to prepare. Use that time wisely and, you know, take the classes and really get yourself ready for that birth. The more you practice and the more you prepare, the easier this is going to be for you.
Yeah,
SubhanAllah.
and you know your choices in childbirth. You still
Yeah.
have a lot of choices. in
Absolutely.
childbirth. You are a decision maker. You need
Yeah.
to, at the end of this class, you write your birth plan.
Yeah.
I want this and this. It's a plan.
Yeah.
You have to write it. This writing your birth plan needs a lot of information.
Yeah.
Having your husband or your mom joining you the class is a lot of enjoyment.
Yes.
You will remember this.
Yes.
You are sharing pregnancy together. You are sharing lovely moment together.
Yeah, and I will just say, you know, you mentioned you have choices in childbirth, sweetheart. If you don't know your choices, you have none.
Yes.
Somebody else will
That's
make
it.
decisions for
Yes,
you.
a lot.
Yeah, and that's dangerous. You need to make your own decisions, grow up, and be responsible for your own health care.
Yeah.
Really.
Another thing is for attending childbirth classes is I'm saying to many women, nothing is a must,
Yeah, yeah.
but we work as a team.
Mhm.
In birth, we work as a team. So
Yes.
and the work is mainly for mom. Mom has to know what is going on in her body and how to deal with waves or energy that comes to her.
Yes.
How to breathe, how to relax.
Yes.
It's not that the right time at birth to tell her breathe this way or
Exactly.
relax this way or assume this position. No, she has to
It
know.
has to practice.
Yes, she has to practice, and
Yeah.
at the time of labor, we just give her like advice. We remind her the
Yeah.
doula work and being with her. Yalla, breathe with me, relax this way,
Yeah.
squat the way that we.
Yeah, it's easy to remind you. It's not
Yeah.
easy to teach you in labor.
No.
Remind you in
will
labor
not
is one thing.
listen.
Teach
will
you in
not
labor,
listen
yeah,
and
you
you
can't.
You cannot listen
You
to
can't.
anyone. So if you just want your birth is empowering, you know your rights, you know what to do in birth, this will be like a completely different. And every woman attending childbirth classes, even
They come very
yes,
empowered.
very
Yeah.
empowered. And
Yeah.
many women, you know, they told me we see a lot of videos and info on media,
Yes.
but when they attend the class, you find it's really different.
Much more in depth.
Much
more in depth. Yeah.
So now we have childbirth educator in Egypt. We have doulas. Please, please, please. I would really advice from my heart. If you gonna have a good experience and to maximize your empowerment in birth and having a good experience during pregnancy and labor, please attend
Yeah.
a good
Absolutely.
childbirth education classes and have a doula in your
Yes.
birth.
And I would also say if you have a heart for serving other mothers, consider becoming a doula because we need more. There's a lot of birthing women in Egypt. We need more doulas.
Yes.
Absolutely. We can never have enough. SubhanAllah.
Imagine being a doula is okay. Being a doula is a job,
Mhm.
a job opportunity for every woman.
Yes.
And what
And
you
it's a
need
job
to
of
be-
compassion and it's a job from your heart.
Yes, so this is what I'm saying.
Yeah.
What you need to do is not to be like certified from wherever, but what you need to have a passion to help
Yes.
women and a passion from heart
Yes.
to help women in labor, in birth, and in breastfeeding too.
Yeah, yeah, absolutely. Absolutely.
So life, and maybe the generation, our generation will change if birth is different and babies are breastfed.
Ameen ya Rab.
I mean, thank you,
Alhamdulillah.
Aisha.
I love you. Mwah.
Bye bye.
Thank you. Assalamu alaikum.
Close.